This video, Why Quality, discuss the importance of applying quality in healthcare organizations. In order to answer this question, we will illustrate some historic situations and how quality applications could have helped to improve them. High healthcare spending. This big problem was noticed in the second half of the last century. In the United States, for example, healthcare spending represented 15% of gross domestic product in 2002, compared to 14% in 2000, and expected to reach 18.5% by 2013. Many small businesses stopped offering healthcare benefits at all. Other businesses refuse to take on full-time employees because they cannot cover the cost of healthcare benefits. US business cannot continue to compete in the world marketplace unless they control healthcare costs, but they cannot compromise quality in the process. This slide shows how healthcare spendings were increased from the second half of the last century to the first 8 years of the 21st century. And this slide shows healthcare spending to the gross domestic product in the USA that was almost stable and started to decline slightly in the last few years. The second big problem was claims against healthcare institutes. We have the malpractice crisis in the 17th of the last century, another malpractice crisis in 1985 to 1986. We have very famous suits like Lenres vs. in 1955, Darling vs. Charleston Community Memorial in 1965, Gonzalez vs. Newark and Mercy Hospital in 1973, Elam vs. Colleague Park Hospital in 1982, and Patrick vs. Burgett in 1986. Factors that might increase this problem are technological advances, adding new risk opportunities, increased consumer awareness and the ease of initiating lawsuits, expanded media coverage of healthcare, resulting in increased patient expectations and increased perception of wrong when none is present, depersonalization of the physician-patient relationship, and contingency fee system for lawyers and deep pocket laws affecting insured defendants. And the third problem was tough competition of industrial products all over the world, and this healthcare spending increases the cost of production. The main process of payment for healthcare services was fee for service. The patient comes to the healthcare center, and after all necessary and unnecessary kinds of investigations and treatments done to him, a bill will be paid by him or his company. This led to uncontrolled payment of big amounts of money. Now, we are trying to extend healthcare insurance and change the way of payment into prepaid by collecting a fixed amount of money at the beginning and provide all kinds of medical services the client needs during a certain period of time. To the organization, this method have great benefits as they collect a good amount of money for a group of clients whether they will be sick or not, and they can spend some of it to add new equipments or new services and put a robust financial plan for their organization. To the payer also, or employers, prepaid method lets them accurately calculate their spending and not confronted with big amounts of money to be paid at a regular time, and as a result of that, they could adjust an accurate budget for their business. In healthcare organizations, they found that the most expensive part of healthcare services is when a patient admitted to the hospital. In order to avoid hospital admission to their clients, they paid great attention to preventive medicine, screening tests, immunizations, and health promotion activities like stop smoking campaigns, encourage sporting, and healthy diets. They also developed and strengthened ambulatory care and one-day surgery. And during admission, also, we applied many measures to decrease patient stay, like clinical pathways and infection control. After patient discharge, they developed home care, by which they follow their patient's care at their homes and decrease the chances of readmission. Now, we could look to the new system as a whole. And focus on the work done by the healthcare organization. This will also help these organizations to survive among the tough competition between them. Now, let us look from the patient side. Good preventive measures, efficient ambulatory care, to avoid hospital admission, and home care. Isn't it all beneficial for him or her? Thank you.